All right, what is grazing? First, a definition for you all. Grazing, I define it as eating any time other than your planned meals, your 3 planned meals per day, or your 2 to 3 planned snacks, which are smaller than the meals. Except, of course, there's a couple of exceptions to every rule. During the initial post-op stages. At that time, for those of you who have had the surgery, you obviously know how very small your stomach is. It's only about 2 to 3 ounces in size, so you obviously wouldn't be able to eat enough in one sitting to afford you just those 3 meals and those 2 to 3 snacks. For instance, when you're in stage 1 to 2 weeks post-op, you're only drinking about an ounce at a time. If you remember, how many of you, just to get an idea, by the way, are post-op? Okay, so a lot of you. Okay. So you remember directly right after the surgery when you start on the liquid, you're only drinking first 15 milliliters and then 30 milliliters, which is an ounce. So you're drinking a total of hopefully about 4 ounces an hour, which is not a lot. It's not a lot, but it's what you need to do to make sure that you're getting in enough of the calories and the protein to try to reach your goals for the day. So just as a kind of review, during stage 1, you're going to slowly add fluids up to 4 to 6 ounces per hour, and then work your way up to a total of 80 to 100 grams a day. And then the other exception to that grazing rule would be stage 2, about weeks 3 to 4 post-op. And that's the point where you're trying to transition then from the full liquid diet to starting to incorporate the proteins, the soft, solid proteins. So you're slowly eating 1 to 2 ounces of soft, pureed protein or dairy foods at a time, along with 1 ounce or so of carbohydrate, preferably veggie or fruit. At that point, you're still probably not able to get those 3 meals in with a small snack, not able to get in enough calories and protein. So that's kind of where the confusion lies for a lot of people that I've talked to in the hospital. They're not sure about that transition stage when you're drinking so frequently to the point where you can actually do the 3 meals and the 2 to 3 snacks. So a guideline then would be you're eating at least 5 to 6 small meals daily at that time until you can stand up to about a half a cup or 4 ounces of food at a time. And then that's the point where you can start doing the 3 meals and the 2 to 3 snacks, and where you're going to be more conscious of the grazing and those snacking moments in between those planned meals and snacks. And of course, I just threw in a little reminder, we're all about protein. You're still getting in your 40 to 60 grams of protein from protein beverages at that time. How do you then avoid grazing once you are past that point where you're not having to drink the liquid protein shakes for all of your calorie and protein intake, when you're actually to the point where you can do 3 meals and 2 to 3 snacks a day? How do you avoid grazing? So the key, like we talked before about, is scheduling 3 meals and 2 to 3 snacks a day and sticking to them. And scheduling can be, if you're type A and you need to plan, a week out, is sitting down on Sunday and scheduling out what you're going to eat every day. If you eat everything the same every day, scheduling might be easier for you. If you want to do it when you get up in the morning, that's fine. It's just making a conscious effort to figure out exactly what you're going to eat during the day and even write it down, hold yourself accountable. Sipping sugar-free liquids throughout the day. And you guys can correct me if I'm wrong, but for the most part, the only time you should be getting calories from your liquids after you're to the regular food stage is when you're drinking a protein drink. Okay, so any additives you're putting to your water should be sugar-free, should be calorie-free. Okay. You hear this a lot, and I'm going to reiterate it again though. Once you're to the regular food stage, you're back to eating regular foods, you're on the 3 meals and 2 to 3 snacks a day, you should really be sticking to the no fluids during the meal. But for those of you who are pre-op, I think that's a really important thing to start getting in the habit of right away, because it's one of the hardest things to change. We all drink when we eat, I think, for the most part. It's very important for the reason that you hear a lot, because you don't want to stretch your pouch, you don't want to overfill it. but also because when you have liquid in your stomach, or when you're adding liquid to your stomach that has food in it, you're increasing the transit time that food is going through your stomach. You can think of it kind of like your kitchen sink. When you have little bits of food in it and you're trying to wash it down, you add water to it and it goes down quickly. Your stomach is the same way. And you don't want the kitchen sink effect with your stomach. You want it to move as slowly as possible so that you feel full longer. We all know that grazing or eating in general can be very attached to different emotions. So when tempted to graze, it's very important to ask yourself, am I really hungry, or am I just bored? Am I tired? Am I sad? Am I happy? Make an effort to make that conscious decision of why you're eating. Is it because it's to fuel my body because I'm exercising and I need that protein, or is it related to an emotion? Bariatric surgery is not meant to deprive you of your favorite foods and make foods not fun anymore, not enjoyable anymore. So I know that people, they do have their hunger return. They do still crave sometimes those favorite comfort foods. It's okay if you want a particular snack food to occasionally work it into your next meal. Lime Tostitos for me. I know if I went through this surgery, I would have to work them in once in a while. They're my favorite snack food ever. So that's okay. It's just a matter of consciously making that effort, like I said, to make sure that you're working it in and it's not just a spur of the moment sort of intake. So the bottom line then about grazing is to stop and think before you eat and to make sure that all of your eating is mindful. When grazing is occurring, a lot of times it's because of the lack of planning that kind of leads to the hunger, which leads to the poor choices, or because, like we talked about, the food is there. You're at work and it's everywhere. So some of the things that people have told me and the things that I've kind of thought, well, what could combat those situations would be having healthy snacks readily available. And healthy snacks defined with post-bariatric surgery would be a high-protein snack. We want all of your snacks and meals to be based on protein. So I went ahead and just made a quick list of some of the more portable protein ideas. And a lot of these are very obvious that you guys probably know about, but just as a review to throw them out there, ones that you can kind of take with you every day. Prepackaged protein shakes, obviously. Protein bars as well, but ones that follow the same guidelines as the protein shake. Mozzarella string cheese is a nice portable snack. Shredded beef jerky. I read about this online, and it seems like an awesome idea for how hot it is in the desert here, for something just to have in your car that's not going to melt to a pool of mush. Peanut butter is another great protein source. It obviously is higher in fat and also has carbohydrates in it.
Can I ask you a question about the peanut butter? When you talking about the peanut butter, you just get a spoon and...
Well, you can buy individual servings. Like I know Smucker's makes individual serving sizes of peanut butter. I think Jif has some peanut butter to go now.